दिमाग हैन हेल्थ भन्नाले स्वास्थ्य सो मानसिक स्वास्थ्य है मेन्टल हेल्थ र मेन्टल इलनेस चाहिँ टु डिफ्रेन्ट थिङ योर माइन्ड इज एबल टु कोअपरेट विथ एनी टाइप अफ स्ट्रेसर इन लाइफ एन्ड विल बी एबल टु मुभ योर लाइफ नर्मल फङ्सनिङ भइरहेको हुन्छ है तर जब मेन्टल इलनेस हुन्छ you'll be having the disorders like depression, it's very common, anxiety is very common, okay? And there are many more, right? Those are all mild, like mild and severe, right? Neurosis and psychosis. Psychosis manalite, alikati manchile bujhihalla psychoto, right? Alikati hallucinate गर्ने, delusional, right? उनीहरुमा illusions हुन्छ, right? Whereas like anxiety, depression hallucinations हुन्छ anxiety हुँदा हुन्छ what do you mean by anxiety तपाईले anxiety के बुझ्छ so but we get lot of college students from our Bangla Hoki Alpine Hoki I think Alpine Hoki छ मेरोमा patient and mostly I think young adolescents is facing depression and anxiety. And the organ छ भन्दा insomnia. Insomnia भनेको बुझ्छ के हो insomnia? Insomnia लाई के हुन्छ मान्छेलाई सुत्नु सक्दैन है so insomnia does not यस्तो depression ले तपाईलाई insomnia हुन्छ anxiety ले पनि हुन्छ various causes ले पनि हुन्छ तर insomnia एउटा particular disorder हुन्छ like you don't have any guilt any trauma any remorse तर पनि तपाईलाई अचानक निन्द्रा लाग्न छोड्छ नि है तपाईकोमा स्ट्रेस छैन you have been dealing with your life you are dealing with your academic life तपाईको personal life professional life तपाई राम्रै गरिरहेको छ भने पनि कोही बेला तपाईलाई अचानक निन्द्राको बिमारी हुन सक्छ है so that can be caused by अब हाम्रो हिल एरियामा बेसी हुन्छ because हाम्रो हिल यस्तो हुन्छ नि हैन सो प्लेन यस्तो हुन्छ they get the direct sunlight whereas हाम्रोमा direct sunlight पाउँदैन है especially people from Rabangla downtown उनीहरुलाई vitamin D को deficiency हुन्छ है vitamin D को deficiency भएपछि पनि निन्द्रा लाग्दैन मान्छेलाई प्रेसर को प्रब्लम प्रेसर फ्लक्चुएट भइरहेको छ भने पनि कोही बेला निन्द्रा लाग्दैन बुझ्नुहुन्छ so next time I can see all the vacant spaces so I just want you to learn something about mental health है तपाईहरु जसरी बस्नु भएको छ यहाँनिर so this group will talk about mild mental illness next session ma and this group will talk about severe which is psychosis right तपाईले गुगलमा पाइहाल्नुहुन्छ अहिले त गुगल रेडियो रेडियो सबै एभ्रिथिङ इज अवेलेबल you just तपाईले डाउनलोड गरेर आउनु भनेको हैन just find some topics right just read through it so that हाम्रो communication अब जुन चाहिँ हाम्रो awareness छ this is not a counseling right I think it fosters your awareness जब group counseling कहिले हुन्छ भन्दाखेरि when people like तपाईलाई पनि suppose depression छ अरे उहाँलाई depression छ अरे उहाँलाई depression त्यो particular group like एउटै illness भएको मान्छेसँग जब हामी यसरी कम्युनिकेट गर्छ यो शेयर गर्छ उसको थट्स सोचाइले के भन्छ त्यो टाइम चाहिँ that is called counseling right अहिले चाहिँ this is just aware just to make you aware how important mental health is है तपाईहरुलाई हेर्दा है continue walking well you go and see a doctor right हो कि हैन तर जब तपाईले if you are not feeling better है तपाईको मन उदास बसिरहेको छ अरे छटपट भइरहेको छ अरे है पुरा रेस्टलेस भइरहेको छ अरे तब हतपत डक्टरमा जानुहुन्छ किन why people will judge you भनेर कि why you are not feeling well, you are not feeling good within yourself तपाईले आफ्नो बारेमा राम्रो सोचेको छैन नेगेटिभ थट्स मात्रै आएको छ तपाई डक्टरको जानुहुन्छ मान्छे let's talk about people, not just what. Overall, general human beings. Jancha, Chandani, right? Adpatuna, feelings becomes up. Right? Why? Because of the stigmatization. Right? Mental health professionalism does not deal only with insane people. Yes, we do. But the psychosis, right? Insane people should not be dealt. Right? It's not that a normal people cannot come up for counseling or cannot come up for therapy. Right? मान्छेलाई normal मान्छेले कतिलाई stress हुन्छ, exam stress हुन्छ, त्यतिखेर पनि you can take up counseling. Right? Professional will guarantee एउटा stress हुँदाखेरि as an individual सबैकोमा हाम्रोमा coping skills हुन्छ है, but कसैले positive principles use गर्छ, कसैले negative use गर्छ. Just if I'm feeling depressed, my mood effect is not one single 2 weeks. Right? So कतिजना like मैले चाहिँ suppose if I'm smoking, drinking, just to forget that particular emotions. So emotions like just to forget that emotions, I start drinking, I start smoking, okay, then I can cannabis whatever, couple of drugs opioids, that is negative or positive? That is positive or negative? Negative. Right? But stress is low. There is nobody who doesn't face stress in this world. Globally, I think 89 to 90% has stress personally, professionally, right? Personal relationship issues, right? But some of them, what they do? Meditate person, right? कसैले एउटा हबी खोज्छ, माइन्ड डाइभर्ट गर्ने, है? कसै वक गर्छ, कसै जगिङ गर्छ, कोही स्विमिङ जान्छ, एनी काइन्ड अफ फिजिकल एक्टिभिटी, जिम जान्छ, एनीथिङ. Okay? So when actually let me tell you the scientific reason, when you are actually doing any kind of physical activity and depression doesn't mean you are depressed. Okay? I think class analysis right? What feel good about it, right? Do you think that is depression? Is that depression? Depression depression, clinical depression diagnosed या the anxiety diagnosed right? Symptoms, at least 3 of the symptoms, anxiety or depression, it has to be 2 weeks or more than 2 weeks to be diagnosed with disorder, right? Suppose the anxious feeling right? And you come to the clinic, we won't say it is the anxiety disorder, we'll just say it's an anxious effect. So depression is that is not depression. Right? The neurotransmitters in the brain, there are happy hormones. Have you heard about happy hormones? Oxytocin, dopamine, serotonin. So the neurochemicals then you go through depression. Okay? So, and with depression, especially, push the symptoms managed pharmacological treatment. They give it for a certain period of time. Then after that, we use therapy on them. Right? We ask them to sometimes patient convenience, what do you like? So you keep it forward. Anything. It's not like you go gym swimming whatever you like. Physical activity jogging 40 minutes, 45 minutes back, those happy hormones is secreted in. Okay? So that's why